So one of the most common questions we get in a chiropractic office is when someone comes into the office and they say that whenever they move their neck, they hear this crunching or grinding sound. And they want to know what's going on, is it dangerous, and is there anything that can be done about it? The honest scientific truth is that no one really knows exactly what's making that sound and making those noises. We know what the sounds are when someone takes their knuckles and they pop their joint, or when someone gets a traditional chiropractic adjustment, that those are likely to be gas bubbles being opened up and released inside of a joint. But as far as those grinding sounds when people move their neck, that one's a little bit more ambiguous. My suspicion is that inside of our necks and really inside of all of our joints, we have all of these soft tissues inside of there. We're made up of ligaments and all the tissues that surround our joints with fascia and even scar tissue that is recovered from injury. And all that makes up what ends up holding a lot of our body parts together. And whenever we have an injury or whenever something happens to our neck where we might have a strain or something deforms some of these ligaments, then some of those tissues might start to rub against each other and create a lot of friction. And what you're likely hearing is the sound that is coming from the friction between those tissues. Now, the good thing is the vast majority of this is very benign. No harm is going to come from it. People just end up having some noisy joints. And while it can be disconcerting and people feel super uncomfortable about it, people don't feel pain related to this issue, and people don't actually have any specific problems with dysfunction related to this issue. Nevertheless, people still seek out treatment to try to solve this problem. The problem is, if you don't know what the issue is, then treating it can be problematic. And we have people that come in and when they get an upper cervical adjustment, they say that the sound decreases and it goes away and we're happy about it, but that has nothing to do with the fact that we're actually trying to make that sound go away, because we're not. All we're trying to do is improve the mechanics and the biomechanical alignment of the neck. And if that happens to improve, then great, but it's not something that we're necessarily chasing after. We also have people that even when we get a great adjustment on someone, that they still feel this problem happening in their neck and they still feel that sound, but it's not problematic, but their anxiety about the problem is super problematic. So if this sounds like you, please just take a moment and just realize that just because you hear these weird noises doesn't mean that anything is actually wrong. And some people, especially as we get older, we're just going to have some joints that are noisy. And the best thing that we can do is not let it worry you or discourage you or concern you, and really just find ways to live with it and find ways to ignore it and seek out other ways to distract yourself from it.